Complex basic care and comfort practice test. Question 1. A nurse is taking care of an elderly patient with a significant essential tremor that includes an intentional tremor. Which of these assistive devices would be most beneficial to this patient for his activities of daily living? A dressing stick, a leg lifter, a voice amplifier, a button hook. A button hook is specifically designed to help individuals with fine motor deficits, such as significant tremors, fasten buttons, which directly aids in the activity of daily living, ADL, of dressing. Question 2. An emergency room nurse is giving discharge instructions to a 15-year-old male who has suffered an orthopedic injury during a soccer game. He has been instructed to use crutches and limit weight bearing until further evaluation by a specialist. When instructing this patient, which of these is the correct way to describe the proper use of crutches? Keeping the arms slightly bent, place the crutches about 1 foot in front of you, shifting your body weight to the hand grips as you swing your uninjured leg to, or just in front of, the crutches. Keeping the arms slightly bent, place the crutches as far as you can in front of you, and allow your body weight to rest on the armpit pads while you swing your uninjured leg to meet the crutches. Straighten the arms and allow your body weight to rest on the armpit pads as you swing your uninjured leg in front of you, then pull the crutches to your standing leg. Straighten the arms and place your body weight on either the hand grips or armpit pads as you swing your uninjured leg as far as you can in front of you. Proper crutch use requires keeping the arms slightly bent, placing weight on the hand grips, never the axilla, to prevent nerve damage, and placing the crutches a safe, manageable distance in front, about 1 foot, to maintain balance while swinging the uninjured leg forward. Question 3. A middle-aged female with Meniere's disease is hospitalized for another condition. During her stay, she has a severe attack of Meniere's. Which of these assistive devices would be least helpful to implement into your care plan? A shower chair, a personal sound amplifier, a utensil cuff, a walker. Meniere's disease affects the inner ear, causing severe vertigo, tinnitus, and hearing loss. A shower chair and walker help prevent falls due to vertigo. A sound amplifier helps with hearing loss. A utensil cuff is for fine motor/grip issues, which is unrelated to Meniere's. Question 4. You are caring for a patient who has suffered a severe traumatic injury. He is currently catheterized. During your shift, you note that the patient has only produced 150 cubic centimeters of urine. You check his total output in the past 24 hours and it is 350 cubic centimeters. By definition, this patient has which of these diagnoses? Polyuria, oliguria, dysuria, anuria. Oliguria is clinically defined as a urine output of less than 400 ml in a 24-hour period, or less than 0.5 ml/kg/hr for adults. The patient's output of 350 ml falls perfectly into the definition of oliguria. Question 5. A 2-year-old presents to the urgent care clinic for cerumen impaction. The nurse is instructed to perform an ear irrigation. Which intervention should the nurse take? A. Position the child with affected ear facing upward. B. Pull the pinna down and back. C. Pull the pinna up and back. D. Warm the irrigation fluid to body temperature. E. Direct the fluid stream at the superior wall of the ear canal. A, B, and E. A, B, D, and E. A, C, and D. A, C, D, and E. For a child under 3 years old, the pinna must be pulled down and back to straighten the ear canal. The fluid should be body temperature to prevent vertigo, and directed at the superior wall to avoid damaging the tympanic membrane. Question 6. The nurse is caring for a patient admitted for a severe flare-up of inflammatory bowel disease. The physician has ordered an enema containing betamethasone. The nurse knows that the commonly used type of enema to give a medication is which of these? Carminative enema, return flow enema, cleansing enema, retention enema. Retention enemas are designed to be held in the bowel for a prolonged period, usually 30 minutes to several hours, specifically to allow the intestinal mucosa to absorb medications, such as corticosteroids, betamethasone, for inflammatory bowel disease. Question 7. A nurse is caring for a patient who needs an enema. Which of these is the best position in which to place the patient followed by the correct description of the position? Fowler's position, patient lying on his or her back with the head of the bed lowered so that the feet are elevated with the knees bent and legs apart. Sims position, patient in a prone/lateral position on his or her side with the upper leg flexed and drawn in toward the chest and the upper arm flexed at the elbow. Lateral position, patient on his or her side, right or left, with knees slightly bent and a pillow placed between the legs for comfort. Right prone position, patient lying on his or her stomach with the right leg and knee flexed. The left lateral Sims position is the standard and best position for administering an enema. It follows the natural anatomical curve of the descending colon and sigmoid colon, allowing gravity to facilitate the flow of the enema solution deeper into the bowel. Question 8. A nurse is planning care for an immobile, bedridden patient. Which of the following is not a complication of immobility? Contractures, decubitus ulcer, S, diarrhea, hypercalcemia. Immobility slows down gastrointestinal peristalsis, leading to constipation or fecal impaction, not diarrhea. Contractures, decubitus ulcers, pressure injuries, and hypercalcemia, due to bone demineralization, are all classic complications of immobility. Question 9. Which of these complications of immobility is correctly paired with the proper nursing intervention? Bone demineralization, passive range of motion exercises twice daily. Depression, maintaining a dark and quiet environment. Constipation, frequent repositioning every 2 hours. Atelectasis, deep breathing exercises and incentive spirometry. Atelectasis, collapse of alveoli, is a major respiratory complication of immobility. Deep breathing exercises, coughing, and using an incentive spirometer actively expand the lungs and are the correct primary interventions to prevent and treat it. Question 10. A nurse is taking care of a 20-year-old male who is post-op for a surgical repair of a right tibia and fibula fracture following a motor vehicle accident. The patient has an external fixation device. Which of these is true concerning the nursing care of this patient? The neurological examination is normal if he has some loss of sensation and paresthesias in the right plantar surface and toes. The patient will experience a high degree of pain and muscle spasms that will require large amounts of pain medications and muscle relaxants. The skin examination should demonstrate warmth, redness, purulent drainage, and edema at the sites of the pin insertions. Frequent repositioning will be necessary to ensure his comfort and prevent skin breakdown. Frequent repositioning is a standard and crucial nursing intervention for any post-operative, immobilized patient to prevent pressure injuries, skin breakdown, and ensure comfort. Loss of sensation, A, is a sign of nerve damage/compartment syndrome. Purulent drainage, C, is a sign of infection. Question 11. A client is discussing starting acupuncture to help with smoking cessation. The nurse educates the client that acupuncture is contraindicated with which conditions: A, pacemaker placement; B, seizure disorder; C, arrhythmias; D, hypertension; E, Coumadin, warfarin, therapy. A, B, and E. A, B, and C, C and D, A and E. Acupuncture often involves the use of electrical stimulation, electroacupuncture, which is contraindicated for patients with pacemakers. A. Inserting needles into the skin is contraindicated for patients on active anticoagulant therapy like warfarin. E. Due to the high risk of uncontrolled bleeding. Question 12. A nurse is beginning a new position working in a pain management clinic. On her first day, her precepting nurse asks her what the 4 phases of pain are, in sequential order. Place the 4 phases in the correct order. A. Modulation. B. Perception. C. Transmission. D. Transduction. B, C, A, D. A, B, C, D, D, B, C, A, D, C, A, B. The physiological process of nociceptive pain occurs in 4 sequential phases. 1. Transduction, stimulus converted to electrical energy. 2. Transmission, signal sent to the brain. 3. Perception, brain consciously recognizes pain. 4. Modulation, brain sends inhibitory signals back down. Question 13. A nurse is evaluating a young adult patient who has presented to the emergency department with the chief complaint of abdominal pain. If the nurse is using the PQRST method of pain assessment, which of the following questions should be asked for the S portion of the assessment? Have you ever had these same symptoms previously? And do you have a history of a previous abdominal surgery? Tell me more about your pain. Is it sharp, stabbing, superficial, or does it start and stop? How did your pain start, and is there anything that you can do that stops your pain? How severe is your pain on a scale of 1 to 10, where 1 is minimal pain and 10 is the most intense pain, and are you experiencing any other symptoms in addition to your pain? In the PQRST pain assessment acronym, S stands for severity. Asking the patient to rate their pain on a scale, example, 1 to 10, directly addresses the severity of the pain they are experiencing. Question 14. A hospice nurse has been caring for a patient with terminal cancer for the past 2 weeks. The nurse has implemented numerous interventions during this time with the patient, primary caregiver, and family. As the nurse assesses the effectiveness of the care plan, which of these should be the highest priority when measuring the actual outcomes with the expected patient-stated goals? Spiritual and religious needs, pain and symptom control, depression and anxiety relief, dehydration and electrolyte imbalance correction. In hospice and palliative care, the absolute highest priority is the patient's comfort. Therefore, evaluating the effectiveness of pain and symptom control is the most critical aspect of measuring care plan outcomes against patient-stated goals. Question 15. Which of these typically does not factor into a patient's perception of and response to pain? Past experience with pain, support system, fatigue, gender. While societal expectations might influence how pain is expressed, gender itself is not considered a primary physiological or psychological factor in a patient's internal perception of or intrinsic response to pain, unlike past experiences, fatigue, and support systems. Question 16. A nurse is giving discharge instructions to a 45-year-old male who has been hospitalized for chronic pancreatitis. Which of these statements should be a critical part of the dietary counseling for this patient? Do not take multivitamins or calcium supplements. Drink plenty of fruit juices. Eat foods high in fat and cholesterol. Avoid alcohol entirely. Alcohol consumption is a primary cause and major exacerbating factor of chronic pancreatitis. Absolute and complete abstinence from alcohol is the most critical lifestyle and dietary modification required to prevent further pancreatic damage and severe pain attacks. Question 17. The nurse is performing a nutritional assessment for a patient who is 134 kilograms and 1.93 meters in height. Which of these would be a correct statement about this patient's nutritional status? There is not enough information given to assess the patient's nutritional status. This patient is underweight and in need of weight gain. This patient is obese and in need of weight reduction. This patient has normal body weight. BMI is calculated as weight in kg divided by height in meters squared, kg/m²2, 134/1.93*1.93 equals 134/3.7249 equals 35.97. A BMI of 30.0 or higher falls into the obese category, indicating a need for weight reduction strategies. Question 18. The nurse is delivering dinner trays to patients under the care of a colleague due to being short-staffed on her medical surgical floor. She comes across a tray that is not assigned to a patient, but is ordered as a mechanical soft diet. There are 4 patients who still do not have dinner trays. Which of these patients would likely need this type of diet? A patient who is to undergo a diagnostic colonoscopy in the morning. A patient who has gastritis. A patient has renal failure and undergoes dialysis. A patient who is postoperative for a total thyroidectomy. A mechanical soft diet involves foods that require less chewing and are easier to swallow. A patient post-total thyroidectomy will have significant neck swelling and surgical trauma near the esophagus, making swallowing difficult, dysphagia, thus requiring a mechanical soft diet. Question 19. The nurse is working in a pediatrics office and is seeing a 3-year-old female for a well child visit. During the history, the nurse asks how much the child sleeps at night and during daytime naps. Which of these would be an acceptable answer, given the child's age and developmental stage? 10 to 13 hours a day, 14 to 17 hours a day, 9 to 11 hours a day, 8 to 10 hours a day. According to pediatric sleep guidelines, like those from the AAP, toddlers and preschool-aged children, ages 3 to 5 years, require approximately 10 to 13 hours of sleep per 24-hour period, including naps, for optimal growth and development. Question 20. A nurse is counseling a patient with a chief complaint of excessive daytime fatigue. The treating practitioner has ordered that the patient keep a daily sleep log for a period of 2 weeks. The nurse is educating the patient on what elements are important to include in the log. Which of these is typically not necessary to record? Any medications, prescription and over-the-counter, and herbal supplements and the time they are taken. The amount of daily exercise and timing of workouts. The timing and amount of food consumed throughout the day. Sleep partner reported irregularities such as restless legs, apneic periods, etc. While heavy meals right before bed can affect sleep, detailed tracking of the timing and amount of food consumed throughout the day is generally a dietary/nutrition log, not a standard requirement for a targeted sleep log evaluating daytime fatigue.